Courageous Doctors is a newscast about healthcare topics of concern to everyone. From health and safety tips to recall notices and medical news. Here's your host, Dr. Barry Prystowsky.
Hello and welcome to Courageous Doctors. This is the news show for you and your doctor. On the news show today, as always, we'll cover COVID updates, government regulations and Obamacare, other interesting health news, and we'll end with some health and safety tips. All right, let's begin. The Star Ledger has pretty much been keeping us up to date. The hospitalizations have gone up over 6,000. Now, if you remember back 2 years ago when we were in trouble, the hospitalizations were up to 8,000, so we're still not there yet. And we had about 1,600 in intensive care, and now we have like 500. But remember, back then, people were overwhelmed because people were dropping dead in the emergency room and the ICU. It was depressing. We had a killer flu, no way to treat it. We'd never seen it. Now, this is a much milder flu, plus the fact that only half of these hospitalizations are really due to people going in because of the omicron, the COVID. The other half, they just are in there for other reasons and just happen to have it. They just tested them. So, and people aren't dropping dead as fast either. We've had a steady death rate of around anywhere between 8 and 15 daily for a couple of years now, but we're not getting the high death rates we saw 2 years ago. So, yes, the hospitalizations are going up. There is pressure on the hospitals. I think the pressure is more due to staff shortage than to people being overwhelmed with, it was like a war zone 2 years ago. People were dropping dead. They couldn't breathe. ICUs, we couldn't save them. It was just depressing. But now it's just a matter of a staffing shortage too, because a lot of people have the flu themselves, the COVID. Even though it's a milder flu, they have it. It's mainly milder in Jersey because most of us are vaccinated. In the other parts of the country, it might be more severe where they're unvaccinated. But it's mainly due to a staffing shortage. Our hospitals, we're running about one-third short. So we're running on about 2/3 capacity of staffing. And so, and of course, it doesn't help that if Biden gets his thing through the Supreme Court where you can't work in a hospital without a vaccine, even though we think you should have them, of course, and people quit, that's just going to add to the staffing shortage. So Biden couldn't have picked the worst time for that, but his timing's been off on everything. Okay, let's see. The infection rate has been over 1.5, 1.6, so that means it's pretty much spreading. Now, CHOP, Children's Philly, I saw them on TV yesterday, the director of their intake program. He had a really interesting comment. We were talking about the problem with people going back to school because we want the kids back in school. And he said, this is mutated to a milder flu, which I entirely agree with him. Kids should be in school. They shouldn't be out of school. And just wear a mask. And if you're sick, stay home like any other flu. But we should get our kids back in school. They just did terribly at home. And so I agree with Children's Philly. I think they're right. It's a milder flu, and let's get people back to work and back to school. Let's see now. Talking about schools, last night, Senator Sweeney, the outgoing Senate president in New Jersey, the Senate is not going to give Governor Murphy the authority to extend mask wearing in school, which is kind of crazy. If you're going to be in school, probably wear a mask. But the news commentator on News 12 said that Governor Murphy might be able to declare a new emergency even without the Senate's help. But the Senate is not going to allow Governor Murphy to continue to make kids wear masks in school. So we'll have to see what happens there. Let's see. Pfizer has a new drug, Paxlovid. It's available for anybody over 12 and older. Merck has a new drug called Molnupiravir, and these two drugs are similar to a Tamiflu, where they actually kill the virus, just like Tamiflu kills flu virus. They work on not allowing the virus to replicate itself. They said that the Merck one is probably not as good for kids because it affects growth in bones. But certainly for older teenagers, they're both good. And so I hope these become available. I know the government bought a lot of them. Biden bought a lot of them. But I hope they become available, but I don't know when they will. Reuters said that Pardes Biosciences has a protease inhibitor similar to the medicines used in AIDS. So I don't know when that's going to come out. Medical press reminds us that Omicron is not responding to Regeneron and Eli Lilly's antibodies, but only to the sotrovimab. So in other words, there's only, like for the last 2 years, I've been sending every vulnerable patient I could to the ER to get an IV infusion of antibodies. It's like having a vaccine that works right away. You get immediate protection. And that's, I'm sure, saved a lot of lives. But now the Omicron won't work for the two that we were using. And there's only one left and not everybody has it. So I know some people are using the old ones anyway and just hoping it works. But we need to get more of that third one available. Let me see what I'm down to now. GSK is working on a drug in England also. Reuters talked about AstraZeneca has an antibody cocktail, tixagevimab and silgavimab. I don't know how available that is. New York Times reminds us that we're choosing the Pfizer and Moderna vaccine over the J&J for boosters due to blood clots, although J&J says their shot still works. Helio talks about the shot-related myocarditis that we were seeing in teenagers. They looked at 140 teenagers that got it. They said that they got over it pretty fast. The teenagers present with chest pain and shortness of breath a couple days after the shot. They said that for 5 to 11-year-olds, it's about 1 out of a million. And I think it's the number's also pretty low for teenagers that get this shot reaction. Lastly, the FDA has recalled COVID tests, the L-Luma. Apparently there was something wrong with it. But from what I understand today, President Biden, it was either Governor Murphy or President Biden. I think President Biden passed something that insurance companies have to cover and approved at-home test, and because they're very expensive, so you don't have to pay for them. And I think you're allowed 8 free tests. I just heard it around 5 o'clock this morning on News 12. So I think you're allowed 8 free tests for each person. And I'm not sure if it was the governor or the president that cleared this, and the insurance has to pay for it. So you just have to use an approved one. And apparently this L-Luma had some problems, which I think they were fixing. MedPress, this is interesting. In Scotland, the government developed a test that has a 99% accuracy and was approved by the National Institute for Biological Standards. So hopefully that makes it to the United States. All right, let's move on to Obamacare and general government problems regulating medicine. Forbes says that 1.6 million did sign up for the Affordable Care Act, and 287,000 of those were new, so that's excellent. Star Ledger says that in New Jersey we have 280,000 signed up on the ACA, and that the cost is covered even more by the government. So let me give you these numbers. Just think about this. If you're earning less than $77,280 as an individual, you're entitled to tax credits and subsidies on your premiums. And if you're earning less than $159,000 for a family of 4, you're entitled. So that's pretty good. The American Rescue Plan that Biden just passed from the White House says that the premium will not be allowed to go more than 8.5% of your income. So that's pretty good. Let's see. Health Payer Intelligence says that, this is interesting, 75% of those of us insured in the U.S. have no idea. We're concerned about medical bills. Yeah, 75% are concerned about their bills, and only 1/3 actually understand their coverage. So I don't know what to say about that. That's pretty bad. Modern healthcare, the Fed regs plan to make drug companies report their costs, but I think they're going to have like a year to start doing this, to report the cost of drugs, the cost of antibiotics, of all kind of drugs, that they actually have to be reported and made public so that you can, choose the cheaper ones, whatever you want to do. And that's part of the No Surprise Bill Act, but it's starting this year, so let's see how that works. Lastly, the Star Ledger, this is interesting, reminds us that the New Jersey Family Leave is a 12-week program, pays 85% of your weekly pay, up to a max of $903 per week. And listen to this, it's paid for by payroll deductions. So out of your payroll, now this is really very low, 1/4%, not 1%, 1/4%, on money you earn up to $138,200. In other words, that comes out to a maximum of less than $390 to be taken out per year, and that will go towards paying family leave. And next year it'll go down to just about $200.
Don't go away, there's more Courageous Doctors after these messages.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Wax Den is a full-body unisex studio. We specialize in hard wax, which is gentler on the skin. We do all types of waxing from head to toe. You can come in with your friends, so you have the moral support. We have hors d'oeuvres. You do have to have a minimum of 8 people for that party, and you would schedule that. Everybody's looking for a hand to hold and then someone to share the experience with, so you can look that up on our website. We have prenatal waxing. We take a little bit more time with the new moms, and a lot of people will schedule that once they hit their second trimester. We do have a waxing membership. It's set up just like a gym membership, and you come in just like you would go to the gym. It comes out automatically, and you just show up for your wax. We have several memberships for different services. We also have wax packages. The phone number is 973-542-8442. The website is www.thewaxden.com. We have 24-hour online booking.
Come to the Wax Den. We wax it all.
Courageous Doctors continues with Dr. Barry Prystowsky.
Okay, let's move on to other interesting healthcare news. I like to do recalls first. Now remember, I always have a disclaimer, so please remember, I'm giving you news that's past history by the time you read this, so please just take it for what it is. All it's meant to do is to make you ask your store, check out, and make sure that whatever you have in your home or in the store is actually not part of these recalls, because they may have already corrected them, and so I'm nothing against the individual company or brand name. It's just to remind you if there was a recall to see if what you have has been recalled. Okay, let's get started. Fox Business News, there was salmonella in onions, and that was Awesome Farms produce and Keeler Family Farms. And these came from Chihuahua, Mexico, and also ProSource produce. So salmonella and onions, check those. Fox News, the Elenos, Greek yogurt, real Greek yogurt mango, did not list that there's eggs in there if you have egg allergies. They found listeria in pork, and I'll mention you a few names. Fully cooked ham and pepperoni, Alexander and Hornung boneless ham, Welshire Wood smoked ham, Garrett Valley farm ham, Butler Bay ham, 5-star brand pepperoni, and big, wide bone-in hickory smoked ham steak. So you don't want to get listeria. It's a bad one. Food Network said that Dole salads have listeria. Again, these may have been cleared up. I'm not saying it's not safe now. I'm just saying check to see if the Dole salad you have was infected. And Garden Classic Salad. Simple Truth Organic Power Greens had E. coli, and Nature's Basket Organic Power Greens had E. coli. Again, check to see if they still do. CNN said that Listeria salads from Fresh Express, that there's Listeria in Fresh Express salads. And Star Ledger reminds us that Tasty Cake cupcakes had problems. They had some kind of metal wire in them or something. Okay, moving on to some other healthcare news. Those were the recalls. Associated Press reminds us it's not just COVID. Remember, out of the 6,000 hospitalizations, only half were COVID, so we're getting flu there too. So flu is on the rise. And in fact, there were 2 children's deaths around the country from flu, not COVID, from flu. CNN said our flu shot, again this year, may not work. It'll work against severe disease and hospitalization, but they said that the most common form of flu, the H3N2, mutated, so that's the one that the shot's not working against, but it should still work against H1N1 and the 2 flu type Bs. The type Bs usually come later in the season. Like we get flu waves from Christmas. They come every few weeks. They get waves right through March. So we'll get the Bs probably in February. Reuters, this is scary. Bird flu. H5N6, that's bird flu. That's the one that'll devastate us just like COVID. It's in 21 humans, so let's hope China can stop this one. And it's spreading in flocks all through Europe and Asia, so they're killing poultry all through Europe and Asia. Lovely. U.S. News, there was hepatitis A. If you were in Gloucester Township and a Starbucks employee, make sure you got your shot. Associated Press, CDC is now recommending hepatitis B vaccine for anyone less than 60. They said if you're less than 30, you probably had it. We give Hep B to all babies. All babies get Hep B. So they said if you're less than 30, you probably had it. If you're over 30, just make sure you had it. I know when I was a school doctor, one of the first things I did, I was a school doctor for 25 years, but I'm going back to the 90s and to the 80s. Going back to the 80s, is I had to line up the teachers and janitors. I had to give them all hepatitis shots, so I had to catch everybody up. Let's see. NBC said that this is interesting. From 2007 to 2019, get a load of this. 1/3 of all the mumps were in children and teens that were vaccinated. Yeah, they're talking about you might need a new mump shot. When you go to college, we get a lot of mumps in college. I think hockey teams, college, that sort of thing. But the government hasn't made a decision yet, so stay tuned for that. But the research points to the fact that we might need to give a 3rd mump shot. CNN mentioned there were smallpox vials in a Pennsylvania research lab. Remember back in 2014, one of the NIH labs has it. So you really don't want smallpox getting loose. And lastly, Associated Press, this is disturbing. 1 out of 44 8-year-olds in the United States has autism, and I think it's even higher in Jersey. It used to be 1 out of 100. Now it's 1 out of 44. I don't know. I see a lot of autism as a pediatrician. So, well, let's move on to, lastly, health and safety tips. We'll go to the FDA. Remember, we reported a lot on sanitizers. They had methyl alcohol, which can kill you, destroy your liver. In the sanitizers, they were all from Mexico. Most of them were from Mexico. But now they're mentioning a different problem, not methanol, some impurities in something called Art Natural Scent Free. There's something wrong with it. So just check it out and make sure that that's been corrected. And Medical Press reminds us that benzalkonium chloride, which they put in disinfectants, benzalkonium chloride, there's nothing wrong with it. But if there's not enough of it in the disinfectant and it's a low level so it doesn't kill all the bacteria, then the bacteria ends up growing resistance. It can make it really worse. So you want to make sure if you're using it in high enough amounts. That was a study done at Macquarie University. Let's see, Fox Business. Oh, this is disturbing. There's a recall on baby clothes that choked the babies. The snaps became detached, and so see if you have one of those, if it's recalled. It's Hannah Anderson's baby long sleeve wiggle set and baby ruffle rompers. Hannah Anderson's baby long sleeve wiggle sets and baby ruffle rompers. Coming close to the end now, not too much more. Med Press. This is interesting. I love to read this stuff. There's a leaf in a Samoan tree called Matalofi that the National Academy of Sciences is studying for anti-inflammation. I like stuff like that. Let's see. We're warned to be careful with choosing meat alternatives. A lot of us eat plant-based burgers, sausage, plant-based meatballs. But London study in Queen's University said you may actually get higher sodium in your plant-based than your meat, so be careful. Lastly, just to end on a fun note, I usually like to do that. Food Networks, I like to do it with them. Looking at oat milk, I drink oat milk, from oats. It's if you take 8 ounces, it has 130 calories. It has 5 grams of fat. That's mostly from the oils added. It has added calcium. Now, the problem was it only has 1 to 2 grams of protein compared to cow's milk. Of course, it doesn't have the casein and all that. But you can add protein to it. You can add like some of the gluten-free milks adds pea proteins and omega-3s, vitamin D, calcium, other stuff. So just be careful if you have a toddler who is not a good eater and he's growing on milk. Probably not a good idea to do that. It only has 1 to 2 grams of protein. You want to make sure that if your toddler can't take whole milk and has to go on a plant milk, just make sure you have a good protein sources. Okay, very good. This was a short one. As always, I enjoyed spending time with you. I hope one day soon, when this COVID's over, to do it live on camera as I used to do for many years. As always, I look forward to hearing from you, your comments. I'll share them on my next show. And you all be safe, be happy, be safe, be secure, and we'll see you next time.
Courageous Doctors, Pioneers and Heroes. Executive producers Barry S. Prystowsky, MD. And Patrick M. Marucki. Post-production Patrick M. Marucki, makeup by Lisa McAllister, salon Jimmy Gerards. Music provided by Video Blocks. Special thanks to American Medical Association and New England Journal of Medicine. Visit us on the internet at courageousdoctors.com.